So hello, everybody, and thank you for joining us to learn more about providing an excellent patient experience. This is the last webinar of our three-part series. The webinar today is being recorded and will be posted to our website. We will be sending the recording and the slides to the participants. I am Shannon Sari, Program Specialist with the National Rural Health Resource Center, which is providing this webinar today. The Delta Region Community Health Systems Development Program is funded by the Federal Office of Rural Health Policy in collaboration with the Delta Regional Authority. Please connect your video feature by selecting the camera icon in the lower left corner of your screen. Your audio is muted by default, and that's to avoid background noise and feedback. Please remain muted unless you have a question. To unmute your line, please select the microphone icon in the lower left corner of your screen. If you dialed in, you can press *6 to unmute your line. You can also communicate via the chat box, which is located on the bottom ribbon in the middle of your screen. If you haven't already, please take a moment to type your name, title, and organization in the chat box so we know who is joining us today. This really helps our presenter get a good feel of the audience on the webinar. Patricia, next slide, please. Before we get started on today's webinar, I wanted to mention the upcoming Value-Based Care Delta webinars, which is going to be a 5-part series. May 6th is Value-Based Care Options for Rural with Dr. Clint McKenney. May 13th is Financial Risk and Value-Based Care Models with Zach Remich at BKD. May 20th is Optimizing Ambulatory Healthcare for the 21st Century with Dr. John Burrows. May 27th is Successful Models to Engage Providers in Value-Based Care with Eric Shelf from Stroudwater. And June 3rd is Best Practices to Work with Community Partners on Population Health Initiatives with Tony Ann Richard, who is from Health Care Collaborative of Rural Missouri. Next slide, please. We have 2 pre-polling questions that we would like you to answer before we get started on today's session. Patricia, please pull up the first polling question. I am blank in my understanding of the voice of the customer. Are you confident all the way down to unconfident? And then if you could give about 5 more seconds, Patricia, to fill it out and then show the results, please. So it looks like 42% are confident and 58% are somewhat confident. Patricia, please pull up the second polling question. I am confident all the way to unconfident in my understanding of how a patient family advisory council can improve patient satisfaction. And then Patricia, if you could give about 5 more seconds. So it looks like 6% are confident, 49% are somewhat confident, 31% are neutral, 11% are somewhat unconfident, and then 3% are unconfident. Thank you all for participating in the polls. Patricia, next slide, please. So in this session, participants will develop an understanding of the voice of the customer, the importance and use of a patient family advisory council or committee, and how to maintain an excellent patient experience. Now I would like to introduce today's presenter, Carla Wilbur. Carla is a senior consultant with Stroudwater Associates and is a nurse administrator with background in critical care, education, and emergency services. She was previously the director of Enterprise Excellence at Wake Forest Baptist Health Lexington Medical Center, where she facilitated lean transformation and was responsible for the development, implementation, and ongoing assessment of comprehensive performance, improvement, and lean redesign initiatives within the healthcare facility. I will now turn it over to Carla to get us started. Ms. Carla?
Thank you, Shannon. I appreciate that. And welcome. I hope that the majority of you were with us for part 1 and part 2 of our providing an excellent patient experience. It all kind of ties together.
Did we lose you, Carla?
Uh-oh, there we go. Did you hear anything I said, Shannon?
We heard the beginning part and then it cut out.
It popped right back into mute again. Okay. So as I was saying, I hope the majority of you were with us for part 1 and part 2 of providing an excellent patient experience, because it's all kind of going to tie together here with the last webinar, part 3. Next slide. So in our first part 1 and part 2, we went over what HCAHPS is and how that is important to our organizations, how establishing high standards are very important, both with our experience, our patient experience, and high standards of our coworkers and other employees. The role of empathy in the patient experience and how that's extremely important. Then the second webinar, we talked about our customers, really defining our customer, and then thinking of our patients and family members as customers, and thinking of other coworkers as customers as well. And then a really important factor in all is communication. And listening skills. So that was the first and second webinar. Today, we're going to talk a little bit more about the voice of the customer and also using a patient family advisory council and how that can benefit our organization, and then how to maintain an excellent patient experience. Next slide. So the voice of the customer, next slide. So these are just a few quotes from people regarding our customers and consumers. One thing that I think I'll point out, one is the last one on the list there. The first step in exceeding your customers' expectations is to know those expectations. So the only way that we can know what our customers, our patients and family members in this particular situation want is for us to really understand through their own voice, their expectations of the service that we are going to deliver for them. Next slide. So what I did before I ever got started here is I did a survey of my coworkers at Stroudwater at my firm. And I didn't survey any clinicians, only those that are non-clinical, and asked them a few questions. So the first was, what are your top 3 expectations of the healthcare provider? And as you can see, did we go 1, 2? Okay, there we go. And as you can see, a lot of it is around competency, compassion, communication, a lot of communication, understanding, connecting with me personally. I think that's really important. I'll focus on that a little bit later. Listening carefully to my concerns, explaining things to me in ways I can understand, professional, and then follow up after 2 days. And I knew who gave me that information, and so I asked the question, "What exactly are you? What do you mean?" And this particular coworker of mine said that they felt like it was really important if you see a provider. Especially in the clinic, if you're seeing a provider for a sick visit, not just basic primary care for preventative annual visits, but if you go in for a sick visit, it was really important that somebody call you after a couple days and see how you're doing. That was one of the expectations. So I thought that was very important and things for us to remember. Next slide. We skipped one of the slides, Patricia, on the healthcare organization. Okay. So what are your top 3 expectations of the organization? So safety and quality, cleanliness, easy flow of traffic. I thought that was really interesting because I had just been in another organization for something that had to do with my husband, and it was an organization that wasn't familiar to me. So I didn't know the lay of the land. And I can tell you they need a great deal of help with their signage. So it's really important that when our patients enter our organization, that they're able to navigate. It's a little bit difficult right now. I know for many organizations that have their entries changed due to COVID, but in any other situation prior to COVID, just making sure that we had our pathways, good signage so that they can find their way around. I remember my former organization, we did a walkthrough as a patient a couple of different times, and looked at the signage and found many signs that were not, they weren't accurate. They had been there, they'd not been changed, things had moved. So that's important to think about as well. Being timely, polite, and professional, of course. Accurate and timely. Scheduling is really important for our patients. They want things to be easy, be able to get an appointment as quickly as possible. And then communication, always the communication situation. Make sure our patients are all set up on the portal if at all possible, because more and more people are using the portal, even for the older patients, such as my mother. She has the portal, and I'm able to help with that and get information for her or make appointments and so forth. And then easy to understand language about insurance coverage. We might not think about that a lot, but for our patients and family members, that's really important. They want to understand, what their out of pocket is, and it's a very complicated situation for them. They look at this paperwork and don't even understand what it means. So we need to keep that in mind. Next slide. The other question that I asked was, if you or your family member experienced a less than ideal visit, what could the organization or provider have done to make the situation better? Again, communication, more communication. One of my coworkers told me the story of her mother-in-law going multiple times to a provider, that every time the visit started out with that whole history again. Instead of, they felt like it would have been better if they would read the chart, try something different. They may have found the issue a little bit earlier instead of the same thing over and over each time they visited. Acknowledge the shortfall, whatever happened, acknowledge that and make it right. Don't treat me like an idiot. That was one. Again, acknowledging the issue and taking corrective action. And then if you do have long wait times, acknowledge that and apologize. It's really important that we, value our patients and family members' time as well. Next slide. So the 10 most common patient complaints and grievances. So this is where patients spoke up in this particular survey, and they found that there were 10 top patient complaints. So one being sleep deprivation. Now we know in HCAPS, there's always that question about quietness at night. The hospital can be a busy place, and that people think, well, I'm supposed to be here and be healing, but they're just always bothering me. So if there's anything we can do to try to help not interrupt our patient's sleep, we need to make sure that we are cognizant of that. And again, the noise is always an issue. Making sure that our staff members know that, I know it's nighttime, and for night staff, it's their daytime. That's when they work. But we have to realize that our patients are trying to rest. Personal belongings being lost. I know at my facility, we had a tendency. We ran at one point, we were losing dentures quite frequently. It's really important that we are that we maintain, some type of process to keep our patients' personal belongings at their bedside, and if possible, send things home that we're not going to that they're not going to use or need, so that we don't risk losing them. The most important and expensive thing that we lost were hearing aids. So that's a really big thing. It can be, financially, it's big for the hospital too. So staff not knocking, that definitely shows disrespect. We should always knock on the door and introduce ourselves before entering their room. Not keeping whiteboards updated. The worst thing that can happen is that you have a nurse's name or a text name on the whiteboard, and they're not really the ones that are caring for the patient. And so for the family, if they want to speak to the nurse, they need to know which nurse it really is. Lack of clear communication and not updating the patient or family on patient's changes. All of our patients are supposed to be, and family members, involved in their plan of care. So anytime that changes, there should be involvement. Continual involvement would make sure that they have the communication they need about any changes that are being made. Messy rooms on HCAPS, we have the scoring that has to do with cleanliness. So anytime that anyone is in the room, we need to give it a cursory look and make sure that there's not something that we could clean up while we're there. Feeling unengaged in their care. Again, if they are part of their plan of care and always involved in any changes, then they shouldn't feel unengaged. Lack of orientation to the room and hospitals. Make sure that we have the TV guide or the remote control guide, or if the patients want to, watch TV, they need to know what channels and how to access or work their remote control in some situations. Lack of professionalism from hospital staff. Remembering that regardless of whether you're on break or you're going home or you're just coming in, you're always a hospital employee. And we need to act as such and make sure that, we're always on, even if we're off. Next slide. So the voice of the customer is a term that's now used to describe the stated and unstated needs or requirements of our customers. And the voice of the customer can be captured in many ways. We can have direct discussion with our patients and family members, or do focused interviews with them. We can survey. Of course, that's what an HCAP survey is. But, many times we don't have a high return rate. So there's nothing wrong with doing a survey, not, of course, your HCAPS, but a little focused survey while our patients are, or when they're getting ready to leave or while they're there. Even having the boxes where they can drop it in a box on their way out. Just any way that we can get some feedback from our patients and family members. Focus groups are really good. We had a great experience with a focus group once before that had to do with an OB practice. And so we talked with patients that had used the OB services at that hospital, and then patients that chose not to use the OB services at that hospital, but were patients of an OB practice, but they decided to go to another hospital. So we wanted to understand why. So we brought them all in as a focus group, and just ask some really specific questions around their decision making, to really understand what they how they perceived the organization, the OB department, and why they chose to go elsewhere. And then for those that did choose that organization, why they did choose the organization. So having focus groups is a great way of getting to the voice of your customer. And then observation, walk a mile in their shoes, observe the patient when they enter the organization all the way through to see what really happens and how they may be reacting along the way. That definitely can show you what's going on in a more real time situation. Next slide. So you need to have a detailed plan to gather and collect all of this information, the customer's needs, perceptions, and so forth. You can do, a variety of different things, but there should be a plan that you have crafted to create methods for you to get the voice of the customer. This helps us to make decisions, of course, on services and processes. Maybe we've realized that the process is broken and we need to address it and fix it. You can create improvement plans based on the voice of the customer. Also, understanding what drives satisfaction. We want to hear the good things too. So, what does help them and what does make them happy? What does please them or create a better experience and how they relate to that? And then it helps us to stay abreast of the changes in our market. If we're listening to our customers, we're also hearing their needs. They may say they wish we had XYZ at our organization because they wouldn't have to travel elsewhere. This helps us to drive improvements, maybe adding different services or adding telehealth capabilities for specific services that are appropriate. Just listening to our customer can definitely help drive market changes. Next slide, please. So patients, family members are our customers, and a lot of people in healthcare hate to think of that patients and families as customers, but they are, and they are consumers, and they are very savvy consumers today. Now that there will be shoppable services, if patients can make make decisions to go certain places for certain services, they will. These large deductible health plans are creating an environment where our patients, because some of this is coming out of their own pocket, so they are going to be shopping for their services and looking, making more information-based decisions. So follow a patient through the entire process, as I had mentioned, developing a patient family advisory council again, or focus groups, and we'll talk more about PFACs. Leadership rounding can give you a large amount of wonderful information. If leaders are rounding on patients, and I know a lot of hospitals have kind of backed off on that during COVID, but prior to and then after, make sure that we do leadership rounding and we talk with our patients and family members, and they can provide you with a great deal of information about how they view their time there. And even with our outpatients, that are there to get radiology or lab tests, what was the experience like? How did everything go today? Staff can do real-time surveys. They can ask, how did we do today or during your stay? What should we know about our team? Hourly rounding is another way of collecting really good information from our patients and family members. Make that discussion part of just your caring of the patient. How's it going? What went well today? What didn't go so well today? That we're never going to know if we don't ask and get what the patients are really thinking. Next slide. So this is just an example of both internal and external voice of the customer. This was a redesign for a registration process, and it really had to do more with stretchers and the stretchers not being cleaned when they redesigned a process to make something quicker. The redesign was completed, but the internal customer wasn't considered. So they were making things better for the external customer, they thought, by creating a process that was a little bit more efficient, but not considering that housekeeping, who would have been our internal customer, had to be part of that process. It resulted in the stretchers not being cleaned. So anytime that we're making a change in any process, we need to really give thought to our internal and our external customers to make sure that there's nothing that impacts either side in a negative manner. Next slide. And then again, back to communication, this comes from the 4 habits model, investing in the beginning and in the end. Investing in our patients in the beginning by really creating more of a rapport. Start talking with our patients about the last time they were there, back to lessons from the field. The last time they visited, this is what we were talking about. That really gives our patients and family members the feeling and a perception that, hey, we know what we're talking about. We've looked at the chart. We know what's going on. And in the hospital as well, your prior shift gave you great report and you all did it at the bedside. So we all know and have, started that process, but it's an investment in the beginning of that relationship. Eliciting our patient's perspective, and that should be their perspective of their care and what's going on in their disease process, and making sure, again, that they are involved in all of the decision making. This is about them. It's not about us. And so we need to involve them in the decision making about their care and their plan of care. Eliciting their concerns, and always making sure that they know what the plan is. If they're involved, they should know that, and go over it again so that we do set the appropriate expectations. Asking for all of their ideas is very important, and their goal. Our goal for the patients may be different than what their goal is. So we really need to involve them and be making sure that we have asked them about, what is your goal? Sometimes we hear, I just want to get home and be able to play in my garden. We just need to understand what their goal is for their care and how that's going to impact their life and their activities of daily living. Next slide. So we'll stop. They have a little pause here before we go on to see if there are any questions or comments, and then we'll move on.
And right now, there's nothing indicated in the chat box for any questions or comments, but folks, please feel free to type in your questions or comments, or if you dialed in, please press *6 to unmute yourself.
All right, well, none heard, then we'll move on. Next slide. So the use of a patient family advisory council or committee. Next slide. And this is my favorite thing. I think that all hospitals should have a patient and family advisory council. This is where we partner with family members, patients and family members, just to understand not only what their experience was at the hospital, but understand their perspective. We can use patient family advisory councils to serve on committees. We can use patient family advisory council members to help us look at new printed materials, so that we have someone else's eyes on something before we publish it, so that we can get their perspective on what does this look like to you? How would you see this if we used this new discharge tool? Anything that helps us get their perspective about, from a family and patient perspective, of care at the organization. Um, I had a patient family advisory council, and the very first meeting, we had 6 members of our patient family advisory council, and one was the wife of a patient, and she had been with her husband while he stayed in our hospital, and it was during the winter time. And one thing that she brought to our attention was that there were no hangers in the closet, so she couldn't hang up her coat. Now, I never even thought about that. Nobody ever mentioned that we didn't have hangers in the closet. We wouldn't have known that had we not had her as part of our patient and family advisory council. And that might not seem really important, but it was really important to her. In addition to that, she also said that she thought we should have a notepad by the bed, which has always been one of my recommendations thus far since then, is because patients and family members sometimes think of something that they want to ask the nurse or ask the provider, and they'll forget it. So they want to have something to write with. Well, she didn't have any paper or pencil or pen, and so she said that she thought that that would be a nice addition. And actually, her words were, if they can do that at the Hilton, then the Hilton Garden Inn, why can't you do it at your hospital? The little pads by the bed. So, good point. So, we added that. So, there are a lot of different things that you can learn from having a patient family advisory council. And it definitely improves the next patient and family member's journey. So, there is a great getting started toolkit. But there are a lot of different models for patient family advisory councils, but they are very, very beneficial. Next slide. So the benefit to our organization, it provides an effective mechanism for receiving and responding to our consumer, again, our customer, and their input. Results in more efficient planning to ensure that our services really meet the needs and priorities. We think we know what people want, but we really don't until we are that patient or we are that family or we ask patients and families. It leads to an increased understanding and cooperation between patients, families, and staff. My recommendation is always to have a couple of staff members on your patient family advisory council so that they get to hear what patients and family members say as well, not just leadership. It promotes respectful and effective partnerships between patients, families, and clinicians. Transforms the culture toward patient-centered care. Develop programs and policies that are relevant to patients and families' needs. Strengthening community relations. It's a great thing to use as marketing as well. In your local paper or newsletter, that your organization has a patient family advisory council, because we want to know what our patients and families think and what they need from our organization. And then recognize that collaboration with their providers through patient-centered care leads to better self-management. There is a lot of data that shows that having patient-centered care provides better outcomes, clinical outcomes as well, because patients are more apt to be compliant, adhere to their regimen, their plan of care, and manage their long-term chronic conditions. Next slide. So patients and families benefits, they gain a better understanding of the healthcare system. They definitely appreciate being listened to and having their opinions valued. Anytime you have a patient family advisory council meeting and you get this feedback, then we owe a response to the patients and family members. Maybe not that day, but once we understand what they have asked for and we've looked into what we can do to make that better or make a change, then we have to follow up with those patients and family members to let them know that we have addressed that. Become advocates for the patient and family-centered healthcare in the community. Understand how to become an active participant in their own healthcare. Develop close relationships with other members on the council. And provide an opportunity to learn new skills. Those are all benefits for our patients and our family members. Next slide. Some of the barriers that have been heard are that there's a fear that patients and family suggestions will be unreasonable. I'm not going to tell you that that doesn't happen. Yes, it does, but sometimes it's just what their expectation, and then we can make sure that we address that and stop any kind of rumor mill from starting. Fear that patients and families will compromise confidentiality. I have never seen that happen. Patients and family members who willingly join a patient family advisory council would all know that they are all part of this council. So it's not like this is something that they have volunteered. If you feel that you need, and I know that there are organizations that have it, that they do sign a confidentiality policy. Belief that customer service program is sufficient to ensure patient satisfaction, that's not true. We can only get from HCAPS what we hear, which is usually a low return rate. But really, to get to the heart of things, using a patient family advisory council to help us gives us much more valuable information. Lack of empirical evidence supporting patient and family involvement in decision making. Belief that the patient and family centered care is not necessary because we know what's best for our patients. As you've already heard me say, that's not true. Belief that it's time consuming and it requires additional staffing. No. Having a patient family advisory council meeting once a month or if not once a quarter is not going to take much time, and it's well worth the investment in your time. And then organizational culture. This is something that has to be led from leadership. Leadership support in a patient family advisory council is key to the success. Top-down approach impacting staff commitment. Our staff members definitely need to be involved. And again, if it's supported by leadership, then we can have a successful patient family advisory council. Next slide. So a little bit about pre-planning. Get your hospital leadership support, select a sponsor. That doesn't have to be, your CEO. It could be someone else in the organization that's your sponsor. And usually I know in lean work, I always had an executive that was our sponsor. And the reason that we did that was because there may be something we need to get leadership approval on. So having that leader that's our sponsor can help us as well. Engaging stakeholders early in the process, form your steering committee so that you can have a group that plans this. Select your own coordinator or liaison who's going to be the person that's going to kind of manage the patient family advisory council. Do some research, find the right model that works for you. Perform a readiness assessment, and then create your business case or your charter. And then on to forming that planning committee, recruitment of members for your patient family advisory council, and then do some orientation for them so they understand the expectations, the ground rules, and how this all is going to work. And then celebrate. You will definitely get a unique perspective by having a patient family advisory council. Next slide. So a little bit about maintaining an excellent patient experience. So we've talked about all of the different things. And now, you put a good deal of improvement efforts in place, and we want to maintain that. Next slide. Key in this is our culture. So it's the expectation of our culture that we are going to maintain this this excellent patient experience. And that means accountability. All team members must be involved throughout the continuum of care. From start to finish, everybody needs to be involved in understanding that we have now created all of these improvement efforts to really boost and support an excellent patient experience. And we want to continue that patient experience, that excellent patient experience. So everyone needs to be involved. Next slide. So the focused patient experience through the American Medical Association recommends 6 steps. So you would know the current state of your patient satisfaction. So your HCAHPS or your own home patient satisfaction, you know your current state. So from there, you need to define your North Star. Where do you want to be? What is our goal? And engaging all of our stakeholders. That means all of our team members in the design of your patient experience. Develop and implement your patient experience strategy, analyzing the feedback so you can determine the impact, and then recognize accomplishments and improve over time. Next slide. So the North Star, and this is just a few examples, this is your ideal patient experience and goals. So like Cleveland Clinic, they call their program Patient First. Whatever relates to your organization, have your team members all do some brainstorming and come up with, what is your North Star? Is that like Baptist Health, healthcare that cares, or Duke, advancing health together, or Dignity, human kindness heals, mind, body, and spirit? We want to describe it. It makes it more real when we describe what our ideal patient experience and goals are. Next slide. So the current state, of course, if you have Press Ganey or any other vendor, look at the 5 lowest scores. Start with those and have some conversation around that. Have some conversations at the bedside or in the clinic and track and trend those for themes. A good time to do that, is when you're doing your leadership rounding. Go to the GIMBA. That's a lean term for where the work is done. Go to the GIMBA. Observe, look at that patient experience, where it's happening. The Patient Family Advisory Council, what did their experience look like? And go from there. Do a mystery shopper approach. How does the process or communication feel? I'd mentioned earlier, walk in their shoes. What does it feel like to go through those steps? Is it streamlined and efficient, or is it disjointed? Is it confusing? Does it just not feel right? You walk in their shoes and you can learn a lot. And then possibly suggestion boxes. Welcome feedback and then share it with the team. Yes, you'll probably get some nasty gram sometime or another, but that's okay. That might help us to make an improvement. But these are just different ways that we can assess our current state of patient satisfaction. Next slide. And then managing for daily improvement. For me, and this is just an example of different types of scorecards. But for your patient experience, you should also have a scorecard. And this should be managed daily. What happened yesterday? Did we get any complaints? Did we get any compliments? What did yesterday look at so we can look like so that we can manage daily and drive improvements. And this should be something that you guys all discuss in your morning patient safety huddles. Is the improvement? What are we doing? What do we need to do better? And communicate with your entire team. Next slide. And then analyze that feedback, of course. It's much like PDSA. If what we did made a change and it made an improvement, that's great. Did we not do so well? We'll start back over again. So, PDSA is a very typical methodology for improvement that most everyone knows. But it's a good way for us to just kind of analyze what's going on. And then recognizing our accomplishments. And I always love to say, don't let perfect get in the way of good. So if we're moving that needle in the right direction, then we need to pat ourselves on the back and keep going. And don't be depressed or upset because it's just not moving as quickly as you want. You'll get there. We have to celebrate every little baby step as we move along this journey. Next slide. So I'm going to read something that's called "Hello, I Am Your Patient," and I think it kind of wraps up very well the voice of our customers. Hello, I am your patient. Next slide. We are creating a chapter in my life. You control a large portion of this part of my life story. For the time being, you and I are co-authors of my experience as a patient in your care. Let's get started. Any story has the following elements. Next slide. You control most of this story. Please listen to me. I may not be a nurse or a doctor, but I know how I normally feel. I don't feel normal, so I came to you. Help me, but please listen to me first. Next slide. Characters. Obviously, you and I have a starring role in this story, but there are many others. Some I will never meet face to face, but they can control my destiny in this story just as much as you can. I want to believe that the only villain in the story is what is making me sick. I need heroes. I need the kind of hero who takes time to listen, to ask, and to respond quickly and kindly. Next slide. I most certainly have conflict. Otherwise, I would not be here. Ironically, as your co-author, I might not fully understand the conflict raging inside me. Norman Cousins wrote a book about the conflict experienced in his own story called Anatomy of an Illness. It's remarkable how many things on his list are the same conflicts I'm experiencing. My conflicts might be that I feel helpless. I may never function normally again, as though I'm a burden to you and my loved ones, conflicted between wanting to be alone but fearing being left alone, a lack of self-esteem, since maybe my illness was caused by me because I am inadequate, resentment, confused. The technology surrounds me, but I may go days, certainly hours, without knowing the results of a last exam, or worse, that the definitive answer is the test results are inconclusive. Next slide. The highest point of tension in any story often involves a decision that needs to be made. I may fear those decisions because they are made about me without me knowing, may rest solely on me, and I don't think I know enough to make that decision. Next slide. Even the end of this little story is written by both of us. It's not just me and it's not just you. but I'm the one who must write the other chapters in my life's book. You can help me resolve this part of my story and continue on the other ones in my life if you will. Please answer my questions. If you do not know, that's okay. Just tell me you don't know, but please get me the information that will help answer my questions. Please tell me about my medications, all of them, even if I take them at home regularly. I may not be taking them the right way, but always tell me about the new medications. Please finish this part of our story in a language and at a level I can understand. Next slide. Please ask me to teach you the information you shared with me rather than merely repeating back to you the same words you used. You see, I need to be as independent as possible when I leave your care. So here we are at the conclusion of our story together. I know it was not always easy. I know you were co-authoring many other stories at the same time as we co-authored mine, but I never felt that there were any others out there. Thank you for your time, your care, and for being a hero, my hero and my family's hero. Next slide. It's a beautiful and mysterious power that one human being can have on another through the mere act of caring. A great truth, the act of caring is the first step in the power to heal. Philip Moffat. Thank you.
Thank you, Ms. Carla. So before we jump into questions, we'd like to take a moment to pull up our post-polling questions. Patricia, please pull up the poll. I am confident to unconfident in my understanding of the voice of the customer. And then Patricia, if you could just give a few more seconds, that would be great. So it looks like 85% are confident and 15% are somewhat confident. Patricia, please pull up the second polling question. I am confident to unconfident in my understanding of how a patient advisory council can improve patient satisfaction. And then if you want to give just a few more seconds. So 71% are confident and 29% are somewhat confident. Patricia, please pull up the third and last polling question. I am confident to unconfident that I will apply the knowledge gained from today's training to improve patient experience. And then if you just want to give a few more seconds here. So 67% is confident, 30% is somewhat confident, and 3% are neutral. Thank you all so much for participating in those post polls. Patricia, next slide, please. So now we're going to open it up for some questions. I know Mr. Doug Tanner from Grove Hill had a question. So Miss Carla, he asked, how would you suggest selecting members for a customer focus group?
So what I would do now, there are hospitals that do a lot of different things. Some hospitals advertise in the local paper and say that they're starting a family advisory council and they were taking applications. Others will pick, and not always our perfect patients, will pick patient and family members that have recently been in our organization, outpatient, ED, inpatient, for those that have swing beds, any of the patients that, and ask them, call them, ask them if they would be willing to be part of a patient family advisory council. And you can, and you'll probably be asked, what type of time commitment. So be ready to give them that answer. It would be, we would only want you come to 3 meetings, or you would rotate off after 6 months, or whatever your organization decides to do. So I've seen it done both ways. When we developed ours, we looked through the last 6 months of our patient roster, and people who had been in and out a few times. Those were the patients and family members that we wanted, because they had experienced several visits within our organization, and it was ideal if they had been in our emergency department, on our floor, and if they had used our ancillaries, because we were able to get a lot more information from them.
Thank you. Doug, did that answer your question? All right. So are there any other folks that have any questions or comments? Please feel free to add those to the chat box or come off mute. All right. So in the chat box, you may have noticed that I just added a survey. We ask that you please complete the survey, and it is very brief. We use the information to improve our offerings and design of future webinars, and we take your feedback seriously and appreciate all of the feedback. Patricia, next slide, please. So we do encourage you to join us for our upcoming value-based care webinar series, which starts on May 6th, once again with Dr. Clint McKenney. Next slide, please. Thank you again, Ms. Carla, for your time today and for presenting the last 3 webinars of this series. And also thank you to all the Delta program participants for joining us. I hope you did find this session beneficial. And as always, please do not hesitate to reach out to us at the center with any additional questions. And I hope you all have a great rest of your day.
Thank you so much.
Thank you.